Good afternoon, everyone. Welcome again. We are very much happy and pleased to have another, I will say, very dynamic doctor from straight away from Pune. When I first met him, एक अलग लेवल का एनर्जी, एक अलग लेवल का आई थिंक डॉक्टर साहब के साथ बात करके समझ में आया कि लेवल है. देर आर वेरी फ्यू डॉक्टर्स इन आयुर्वेदा with this kind of mindset and this kind of vision which Dr. Sagar Thokade have. So I'm very much lucky and pleased to introduce all of you Dr. Sagar straight away from Pune, and we will be definitely knowing about him today. He himself will be launching him, and आप जैसे डॉक्टर्स के साथ बहुत अच्छा लग रहा है डॉक्टर साहब इस प्लेटफॉर्म पे. वी आर ट्राइंग टू लॉन्च ऑल ऑफ यू एंड वी आर ट्राइंग टू एंश्योर कि आप पूरे वर्ल्ड के साथ कनेक्ट हो. एंड आई थिंक
Yes, sir.
जन्माष्टमी की पूर्व संध्या पे एक बहुत अच्छा आज मतलब कोइंसिडेंस हुआ है
Right,
कि आप आई थिंक कौन से सेशन को आज कर रहे हैं and कल जन्माष्टमी है.
right,
So
right, sir.
thank you so much again, Dr. Sagar, and we are very much happy to have you. And please, we hand over the session to you and talk about yourself, about your experience, about your journey. And let me just add your presentation also. So over
Right.
to you, Dr. Sagar. Thank you.
So, yes, thank you very much, Dr. Piyush, sir. I'm very much honored and pleased to be here on platform with you, launching myself and our clinic, Ayur Sagar Ayurveda Clinic, on this prestigious platform of Indian Vaidyas. I'll just introduce myself. I'm Vaidya Sagar Thokade, and I feel very proud to call myself Vaidya because in my whole family or generation there is no other Vaidya or doctor. So of all the generations, and we are the generation next or generation first, you would say, we would say Vaidya. And I'm coming from a very small town, very humble background. And the way I traveled for my education since my childhood is phenomenal. And the journey of a person, of a Vaidya, from of a small town guy to a metropolitan city like Pune is really enriching. So I'll just explain to you what or who exactly is Dr. Sagar. So I'm a proud Ayurveda doctor with bachelor's and master's degree from Maharashtra, University of Health Sciences, and I did most of my education in Pune. And my MD is in Swastharatta and yoga. So I'm very another good news is I have a background of yoga as well, along with the Ayurvedic degree. Then I'm practicing currently as a director of Ayur Sagar Ayurveda Clinic at NVCC ISKCON Temple, Kathraj, Pune. And we are expanding very soon in other places in and around Pune in this coming year. Next, please. So this is my basic educational background. I did my 10th and 12th from Flying Colors, and from my town, I was topper in Sanskrit. Again, for me connecting to Ayurveda, I had a very strong background of Sanskrit since 8th standard, so I could take it up easily, learn the basic principles of Ayurveda and apply it very easily since I had a background in Sanskrit. And then I did my BAMS from DY Patil Ayurveda College in Pune. I did diploma in yoga and Ayurveda from Tilak Maharashtra Vidyapeeth again in Pune. Next, please. Then this is my professional experience. So I'll just share my professional experience in short with all of you. Uh, just as to train or be an established doctor, you need to go through a lot of mentoring, a lot of training. So that I did mainly in Pune, in Mumbai, Thane region as an intern. Then I was assistant in an allopathy hospital for a year, and then I did very enriching journey, very extensive journey for learning the real Ayurveda throughout India. So I trained with AVP Tattva Prakashini, which is intense 15 days program in South India, Tamil Nadu, Coimbatore, and Aryavedya Chikitsalayam. Then I did a lot of training in Palakkad district, where Ayurveda flourishes, right from the first kuti in India to the best medicinal preparation practices, and best panchakarma practices in the south. So I worked with Aushadhi Vaidyaratnam. I trained there as a panchakarma expert, and then I learned few of the techniques or special practices of Kerala from the traditional Vaidyas there. I happen to live with one of the most prestigious families of Itudi, of Marma Chikitsa, of the best Ayurveda teacher in India, the academic best Ayurveda teacher, Dr. Gopakumar sir, Mahadevan sir also. And the first Vaidya I would, as far as I remember from Pune, sir open. So people across India, I would like to tell the Gurukula system, the Vaidyas, they accept you wholeheartedly. So I learned a lot from the south. And here I am after a journey of almost 4 to 5 years after my UG, that I did all the jobs in Ayurveda hospitals, spas, resorts, and clinics. And then I started my own practice since 2015 in Pune. And currently, I am practicing as an Ayurveda consultant at Mediterranean Hospital, which is a hospital, allopathy hospital, and we have a team of doctors who integratively practice in the same place. And then this is my personal clinic where I am chief Ayurveda consultant, Sagar Ayurveda Clinic at NVCC Pune. So next, please. So during my college days, these were all the research activities that I did. The first one is my MD thesis in Swastarutta and Yoga, the study of efficacy of Rakta Chandana Lepa Upakrama in Mukhakanti with special reference to fairness. When I took up this study, it was all about the then craze was all about beauty, and this beauty industry was booming. So I thought of taking up something natural compared to the fairness creams that were available in the market. And my this study was very helpful to tell that the natural ingredients in the Rakta Lepa of Sharangdhara helps a lot, and the natural beauty and freshness of the skin is kept intact after the use. This was the main use of the main outcome of the study. And the second study was did with a group of my colleagues, the then Vaidyas. Uh, we are a team of Vaidyas in Pune who work internationally and locally to propagate Ayurveda. So when I was very young in my MD, and just after BAMS, we did this cross-sectional study of 1500 around 1500 girl students of menstrual health and hygiene. So this was a very enriching experience. So we educated in this research activity. We educated a lot to the local school-going children, and especially the girls and the adolescent girls, and it was very enriching. Next, please. Then these are all the healthcare and Ayurveda training activity which I did. I from right from delegate to manager to organizing security committee chair and all those things. I had been helping when I was in academics. I did teach as an Ayurveda teacher or assistant professor in Ayurveda college for 2 years as well. I did all these activities right from my undergraduate, and I never left learning all this while. And all this, some specific mentions would be uh, right from first year of UG, sir, and the dear uh, spectators and listeners. I was very adamant and staunch on learning the crux of Ayurveda, which is now even spread across India. And because of the online platform, it is very readily available uh, at the click of a button. But then when I started doing this, I just traveled across India, met the best gurus and the best systems of Ayurveda teaching and training, the best clinics and hospitals then available, and through references of Vaidyas, I met more Vaidyas and learned the activities which were going in the same facility. So the specific mentions are Coimbatore, AVP. Then I did from Vaidyaratnam, the Aushadhi Nirman Shastra of Vaidya Dasta Shastri, which is a founder of Panchabhautik Chikitsa. I learned Panchabhautik uh, medicine preparation and use in there. Some of my gurus are Wali sir and this Rajendra sir there. Then uh, then I participated in first year of my UG in Shlok recital competition, and I got fourth place, but it is not mentioned obviously. It is fourth, but I learned a lot from that as well. And then I started organizing and participating with Vaidyas across international and national platforms, and help them make the conferences better, make them reach this knowledge to more Vaidyas, because that's how you learn. And then I came into practice. Next, please. In 2015. Next, please. So this is one of the programs. This is the one of the best programs that I did. This was with one of my mentors from USA, Dr. Lina Takar. I was the chief organizing secretary of this program, and the first ever program which was taken in Lee Meridian, Pune. And it was attended by many known Vaidyas, many renowned Vaidyas across India, and few from other countries. Uh, the success of Ayurveda, the practice of Ayurveda, the propagation of Ayurveda was taken to a whole new next level in this seminar. The whole agenda, or the whole the goal of all Vaidyas is spreading Ayurvedas first. So that is what we achieved here, and we uplifted the mindset of Vaidyas across India and other countries through this program. Next, please. Then I took up a job, small job in South India, in North India, in Rishikesh, Uttarakhand, and I spoke there during the International Yoga Festival uh, because I was already doing yoga since my ninth standard. So I had very much in me. This should be procured, and this was the golden time when Modi ji came and he started. The International Yoga Day celebrations across the globe, and World Health Organization took this up to a whole new level, and the Indian government Ministry of Ayush was found, and this was the time. And then I dedicated, after coming from Rishikesh and all those jobs and learnings that I did in 2014-15, I started my practice of Ayurveda in Pune itself. So one of my gurus gave me an opportunity to teach and train a group of Spanish doctors in Ayurveda. So I took up a program, and at the end of the program, I was awarded with title of Panchakarma Karma Bishop. This is International Ayurveda Association, and I'm talking about Dr. Atul Dakshe sir, who's very famous in India and across European countries. And then contribution, I also contributed in the syllabus design and scientific writing committee of Pranam, which is an organization propagating and teaching traditional Ayurveda in Europe. And then this was the program I was talking about as chief organizing secretary, Ayurveda Success Program, which was done jointly with Dr. Lina Takar of Super Specialty Ayurveda Institute, USA. This was in 2019. Next, please. These are all the pictures. So just to give you an idea, this is my team. The left side photo is the team with which we did the menstrual health and hygiene program, and then this is the group of PG students and colleagues, my batch. Second, we are doing this program in MUHS University, Nashik. And that is the story of Paro in the top right of the screen. Story of Paro, which we used to teach to the adolescent females. And then this picture is about the forest visits and the jungle treks, the Aushadhi, to identify the herbs. To the real Ayurveda or Dravya Guna is learnt in the jungles, not in the concrete jungles or cities. So we usually go on treks every month or every 3 months or so, especially during the rainy season. And this is me during the International Yoga Week in the middle picture, and me doing yoga sessions for my patients and people here. Uh, so this is how I used to do all the activities. Next, please. Now the services that we offer at our current clinic are very basic. These are the very basics of what a Ayurvedic clinician, physician, or and a Vaidya can and do. So this is encompassing all the services that are available in the current practice and for current life, which suits the current lifestyles in and around Maharashtra. And people from across the globe, some of the patients who visit us, they are from other states and other countries. So they also take up the Sagar Ayurveda program as it is that we have. This usually has four basic components. The first one is ahara, second is vihara, third is aushadhi, and fourth is panchakarma. These are the basics. And as a Vaidya, you need to know, of course, the other aspects also. The Nidan plays a very important role. But these four, for us, for the regular patients in my practice, I'm practicing here for almost 10 years now in this city. The experience of I have experience of almost 5,000 plus patients in all the 10 years, uh, and they are all so the quality of therapies, the quality of medicines, the quality of diagnosis, and the diet and lifestyle recommendations that we give is really next level. They are very easy to do and very effective. So the main focus of my practice is we help reduce the the dependency of patients on number of pills. We help reduce their stress in going from hospital to hospital and changing multiple doctors and on all those things. So they have a comprehensive integrated program. The 50% of the result that we achieve for our patients comes from the diet and lifestyle. The rest 50% comes from Aushadhi and Panchakarma, which we, after proper Nadi Pariksha, proper examination, and detailed case history, we take it at the clinic OPD level. And then we have in-house Panchakarma therapy, which is like daycare. So patients from other places come and go. They can stay nearby, or we have a facility for them to stay, just like a hostel or something. And they come as regular patients. So like OP only, all the treatments are done in the clinic. We have two Panchakarma rooms wherein we do all these things. Then these are the specialized programs for children, kids, and the young people. So Garbha Sanskara is for the women, Suvarna Prashan is for the kids, and Rasayan Vajikaran is for the adolescents and young people, male and female both. Next, please. Can we please now wellness programs that we have? Okay, fair enough. Fair enough. If you cannot play that, that's okay. So we had all the programs mentioned on that page. So they are Ayurveda wellness program, the men wellness program, women wellness program. Then we have beauty program as well for females, specifically for females. And then we have the special mind wellness program. And this is our clinic, and this is our contact. Thank you. Thank you.
Thank you, Dr. Sagar. I think it was really interesting to know about your journey, the way you have learned and gained the experience, and I think you have an exhaustive experience in many domains. The identification and the like raw material quality and
Yes,
like preparation of
true.
the medicine is very very important in any
True.
Ayurveda treatment. And if you have that knowledge, I think that will definitely be benefited to the patient. So I request all of you who are in Pune, nearby Pune, or any part of the country or world, in fact, Dr. Sagar is also available in online mode, as well as people who are right now watching and listening, or maybe after this video will be promoted to across the city and the other locations as well. So please connect with him, and he's a very learned and experienced professional, and definitely they will be taking care of your all health issues. And in general also, you can take day to day diet and lifestyle guidance from Dr. Sagar. I think they are specialists and they have an expertise in that
Yeah.
as well, that you
Yes,
can
sir.
analyze your prakriti and accordingly you can customize your diet and lifestyle, which is very much required right now. So I request
Yes.
all of you to please connect with them directly. The phone number, email ID, all is available on screen, and we will definitely promote and spread this across the communities, networks, and like people we have in Pune and nearby cities and the entire country also. So thank you, Dr. Sagar, for your time. It
Thank you,
was
sir.
really a pleasure knowing about you, and looking
It
forward
was
to
an
have
honor,
many
sir.
more sessions in future as well.
It was an honor, sir. Thank you.
Thank
Thank
you.
you.